meeting of the committee will come back to order. The chair would recognize himself on the Pallone amendment. Mr. Pallone, your amendment deals with a wide range of health issues, ranging from school-based immunization programs to emergency and trauma care. I know it represents the work of a number of members who have championed these causes, and you have decided to take all of those proposals, which, in my opinion, really shouldn't be all that controversial because they involve reasonable public health matters that we hope will prevent diseases and allow us to hold down health care causes, not to treat those diseases that could be prevented. The amendment has what's called the Class Act. Could you tell us what the Class Act is? It's a great name.
It's a classy act, Mr. Chairman. No, I'm kidding. I'm sorry. Basically, what this is that people who, now have to get health services, chronically ill people, people with disabilities, who now have to get services through institutionalization, there would be a hospital, nursing home, whatever, would be able to pay into a system, a voluntary, payroll deduction, and after a certain number of years, if their health becomes endangered, they get a chronic illness, or they become disabled, they would be able to tap that, so they'd be able to get those services that normally would be provided by a hospital or nursing home in a community setting. So it's a way of, having people finance over their life, if you will, so that when they get
this
on.
This could help people for long-term.
It's a long-term care system for people with a voluntary checkoff, so that it's paid for, through their payroll. There's no cost to the, to the government because it's. But
it helps people who voluntarily pay into this fund to be able to use that fund.
Right, and this is a major issue, Mr. Chairman, with the disabilities community that have approached me about this many times. I think they approached Mr. Dingell. Sometimes they get very aggressive about it, needless to say. And and it's also something that Mr. Kennedy has sponsored in the Senate, and that's in the HELP bill. Not that I want to mention the Senate, God forbid, but
Well, it is an issue that Senator Kennedy has championed, and it's very much wanted and needed. There are other provisions in the bill. They seem unrelated, but they all have in common provisions that you and the staff felt were worked out and not that controversial. The manual labeling, for example, is something that's now been agreed to by all the stakeholders, that's S-T-A-K-E, stakeholders, restaurants and consumer groups and others, so that people can get information when they eat in a restaurant. There's emergency and trauma care provisions, school-based immunizations, telehealth reauthorization, which is playing more and more of a role in giving people the ability to have assistance from healthcare providers, not in front of them, but who can evaluate the medical situation and advise patients and their healthcare providers. The pain care and management. There is a Federal Torts Claim Act for CHC volunteers. Is this to allow, as I understand it, those people who volunteer at a community health center to be put under the same provisions as employees at a community health center? They would be covered by the Federal Torts Claim Law, so they wouldn't be barred from volunteering and be required to get a medical malpractice health care and coverage for their volunteer period. I strongly support your amendment. It has a lot of good features in it, and I would hope that members have had a chance to look at the amendment and would feel likewise. I want to recognize the gentleman from Georgia, Mr. Gingrey.
Mr. Chairman, thank you. I want to ask the author of the amendment, Mr. Pallone, going to page 7 of his amendment, subtitle H, Nurse Managed Health Centers. I've had to read pretty quickly through this. I didn't see anything in there regarding medical doctor supervision in any way, shape, or form in regard to these nurse-managed health centers. Could you give a little bit more explanation about that? Is there any physician supervision over these centers, or am I correct in assuming that this is just albeit well-trained advanced practice nurses pretty much practicing medicine at these centers free and independent of any other supervision?
I'm going to defer to Ms. Capps since it was her bill.
I appreciate the interest in this. The advanced practice in the areas where there are nurse-managed clinics, there are provisions within the state regulations that advanced practice nurses have the ability to supervise and to carry out those kinds of decisions that are made there in primary care.
The gentleman will yield to me again so I can ask a question.
I yield to the
young lady from California.
I yield to the gentleman.
And I thank the gentleman, and I appreciate Ms. Capps' comments on that. I don't know what the law is in California, but I'm sure it varies from state to state.
Yes, it would.
In regard to that, would this provision, Mr. Pallone and Ms. Capps, would this provision be a federal preemption of all of the state laws regarding?
No, of course not. It would be only, that's why it's set up the way it is as a voluntary or applicable in areas where these kind of provisions can be made.
Okay. And I thank the gentlelady, and I thank Mr. Pallone for that response.
I yield back, Mr. Chairman.
I yield.
Mr. Deal, you wish to be recognized.
Yes, Mr. Chairman, thank you. As I look over this 75-page amendment, I think I have counted as many as 13 separate pieces of legislation, which I think all of them have in one form or another been introduced as separate pieces of legislation. Now, some of these I feel very strongly in support of. In fact, I'm a co-sponsor of some of the individual pieces of legislation that comprise this amendment. Some I have reservations about. I was glad to hear the chairman say that everybody that fell under the menu labeling had already come to agreement. I was under the impression after reading it that the only way you could get out from under it was to have a blue plate special that didn't last longer than 30 days or 60 days, and that was the only way you were going to be able to escape the provisions. But maybe those who would be affected by it have looked at it more carefully than I have. But I have a procedural question of the chairman. Mr. Chairman, as I understand it, this amendment, the Pallone Amendment, is a second-degree amendment and therefore would not be subject to an amendment to it in order to extract portions of it that might otherwise be considered objectionable. Am I correct that this amendment is not subject to being amended?
Gentleman is correct.
All right. Well, I appreciate the response, and I personally would have preferred, and even though it may have taken a little more time, for us to be able to deal with these individual pieces of legislation separately so that people could express their opinions on them individually rather than collectively. But I appreciate the gentleman putting forward many of these proposals that are encompassed within this amendment, and I yield back my time. Thank you.
Let me, if the gentleman from Georgia, Mr. Deal, if you want to divide the question on these different parts of the amendment, I think that would be an appropriate request. Do you want to take out something for separate consideration?
Mr. Chairman, I've heard expressions from some of our members of perhaps an indication that they would prefer to do that. I'm afraid time-wise we haven't had a chance to get a collective judgment on that at this point.
I see. Okay. Well, the amendment, as it was proposed, is...
I would, Mr. Chairman, in light of your apparent offering on that, I would like to request that the menu labeling portion of the amendment be separated out for a separate vote.
Okay. Without objection, we'll put the unanimous consent that the section of the amendment dealing with menu labeling be put aside, and the amendment without that will be under consideration. Hearing no objection, that'll be the order. Are we ready to vote?
Mr. Chairman.
Yes, gentleman from Oregon.
Thank you, Mr. Chairman. I'm just now being able to peruse this amendment, which came out at 9:09 last night, it shows here. Are there any, has this been scored, or do we know how much money we're talking about here? Do you know, Mr. Chairman? Are there any data on the costs of this?
Gentlemen, we yield. These
Yes,
are authorizations of appropriations.
Right.
So we don't have a score on authorizations. The score would be on the appropriations.
So is there like a grand total for the amount that we're authorizing here?
Let me ask counsel if there's a grand total for the amount. Speak up.
Are there totals for each bill? Perhaps I could direct to the council then, Mr. Chair. Could you show me on what page for each of these? I understand there are 18.
If you yield to me, often authorizations spell out a specific amount. Oftentimes authorizations leave it to the Appropriations Committee to figure how much is needed after they examine the request. But we would authorize a program, and then the Appropriations Committee would make those decisions.
And I appreciate that, Mr. Chairman. I also know that oftentimes the Congress is held accountable for not fully funding what's been authorized. Clearly, that was the case in the No Child Left Behind legislation. For many years, there were arguments made that a large sum was authorized and then it was never fully funded. So, counsel, can you direct me to where the authorizations are in this bill, in this 75-page amendment? Oh, your mic's, I'm sorry,
Put your mic
sir.
on.
I'm quickly scanning. All of these are authorizations of appropriations for discretionary spending. So far in my quick scan, the only specific number authorized is on page 24.
Page 24 is the only place that you found?
So far, that's all I've been, pardon?
Okay.
And again, on page 24, there's $10 million authorized for telemedicine incentive grants. And then again on page 35, there's $100 million authorized.
Well, now on page on 24 it says $10 million for fiscal year 2010 and such sums as may be necessary for each of the fiscal years 2011 through 2014. So that's an open-ended authorization?
Yes, sir. There are many programs in the Public Health Service Act that are authorized at such sums as may be necessary.
I see. Are there other specific authorizations?
On page 48.
Page, if I may, page 35, line 4, there are authorized appropriations.
And that's $100 million?
That's $100 million.
For 2010, and then it's open-ended after that?
Followed by such sums as may be necessary.
Okay, thank you.
I am page 44. They're authorized $12 million.
And then such sums as may be necessary?
No, sir.
Oh, that's for
$12
each fiscal year. Wow.
And then again on page 48, $500,000 for each of 2 fiscal years, page 48, line 11. And again on page 56, lines 19 and 20.
Right.
$2 million for fiscal 2010 and $4 million for each of fiscal 2011 and 2012. Page 59, there are, again, such sums as may be necessary, no specified total on line 9 of page 59. On page 65, such sums as may be necessary. And finally, on page 75, for the extension of the Wise Woman program for preventive health screening for women, $70 million, 73.5, 77, 81, and 85 in succeeding years. Those are the totals. I'm sorry, sir, I do not have the current appropriations levels for those programs.
Mr. Chairman, do we have the current appropriation levels somewhere for these programs? Just trying to get in perspective what's being authorized and
with all deference, sir, the Labor HHS Appropriations Committee is meeting this morning to mark up theirs. I don't even know which staff people I would go to at this point to get the current
But do you have it for last year, for the current fiscal year?
I could find it. I do not have it with me now.
We probably won't have time, I guess, so we don't really know. Okay. Thank you, Mr. Chairman. I realize my time's expired. Thank you.
Mr. Chairman. Any further discussion?
Mr. Chairman.
Mr. Chairman.
Let's see, anybody on the Democratic side? If not, we go to Mr. Barton again.
I'm going to yield some of my time to Mr. Booyer and Mr. Shaddy, but I'm going to insist on my point of order. I'm going to use the same rule and the same logic that Mr. Pallone used on Mr. Burgess's liability. In his long-term health care section, there is clearly an item on page 3, line 10, establish mechanisms for collecting and distributing payments. That is clearly jurisdictionally totally within the Ways and Means Committee. So if Dr. Burgess's liability language was not germane because of some jurisdictional totally within the Judiciary Committee, this section is not germane because it is totally within the jurisdiction of the Ways and Means Committee. So, you know, what's good for the goose is good for the gander, Mr. Chairman. And I would yield to Mr. Shadegg or Mr. Booyer because they have some concerns on the.
Would the gentleman yield to me?
Sure. Sure. I'll yield to Mr. Pallone before I yield to Mr. Shadegg.
Well, I just wanted to say very briefly that this was written specifically to avoid the problem that you're raising by saying that the program does not go into effect until and unless the Secretary sets up this, voluntary payroll deduction. So it's written to specifically avoid the jurisdiction of the Ways and Means Committee, and that's my understanding that that's with the language that we have.
Reclaiming Dr. Burgess's amendment was written to give the HHS Secretary that same discretion, and it was ruled non-germane. I mean,
well, the gentleman yielded only briefly. It says specifically the program does not go into effect until a statute is passed that does that establishes the voluntarily payroll deduction. So we'd have to actually have legislation to accomplish that. That's how it avoids the problem that you're suggesting.
Okay. I'm going to yield to Mr. Shadegg.
I thank the gentleman for yielding. It was my intent to seek time on my own because I have a deep concern about the germaneness of this particular amendment. If you go to page 4, it talks about liability protections for volunteers or volunteer practitioners. As I understood Mr. Burgess's amendment, it dealt with the issue of liability. We were told that that was in the jurisdiction of the Judiciary Committee. I, quite frankly, have for years wanted to extend federal liability protections to surgeons working in emergency rooms performing procedures, or doctors performing procedures in emergency rooms compelled by EMTALA. And I assume that if we rule this is jurisdictional, that we can in fact have this amendment, that I certainly intend to offer amendments that deal with immunity. This is a clear grant of immunity to practitioners, and quite frankly, I probably on substance agree with it, but I don't and can't agree with a structure where a Republican amendment on liability is not germane, but a Democrat amendment on liability is germane. And with that, I'll yield back to the gentleman from Texas.
Yield to Mr. Booyer, if I have the time. I think I do.
I thank the gentleman for yielding. My only great concern is, Mr. Chairman, is that we remain consistent. The purpose of the chair is to be impartial in your rulings. Impartiality is one of the most important attributes of leadership. So you cannot be capricious or arbitrary in impartial rulings. So if in fact the Dr. Burgess's amendment was ruled out of order, you can't now claim and say that this amendment is in order. So if you would like to, my suggestion, Mr. Chairman, is if you would like to make this amendment in order, then we should reconsider Dr. Burgess's amendment on medical malpractice reform. We can't pick and choose, and that is my great concern. The other on the subject itself, with regard to the community assisted living servicings and support, is that the CBO has already spoken on this issue, that they've questioned whether it's actuarial sound over the long term and whether premiums will be insufficient to support the goals for which you're seeking to achieve. So I'm really bothered here at the moment that the chairman of the Health Subcommittee, at a markup whereby we were given a 1,018-page bill, then the first amendment out of the box is a 75-page amendment to us that could be a bill in and of itself. I'm bothered both on two grounds, Mr. Chairman, one on substance and the other on procedure. So I'll rest to the gentleman's point of order and ask that the chair be impartial in his ruling.
I yield back, Mr. Chairman.
The chair is ready to rule, but do you, gentleman from Georgia, wish to speak on the point of order?
Mr. Chairman.
Gentleman's recognized.
I did have a question in not pertaining to the ruling of the chair. I wanted to ask either the council or Mr. Pallone on page 74, this subtitle R, extension of the Wise Woman program. I'm not completely familiar with the Wise Woman program. I have some idea of what it's about, but could either one of you explain what that program does? It's a good little bit of money involved at $70 million in fiscal year 2010, 73.5, 77 million, all the way up to 85 million in 2014. So over a 5-year period, we're talking about a lot of money getting up in the
gentleman yield. Gentleman yield.
Of course.
I'll ask Ms. Capps. I know she wants to. Well, why don't I just yield to you if you like, Ms. Capps?
And I don't mean to preempt the discussion because other people know about the Wise Women program. CDC set this up as a pilot in 20 states, and it has been really remarkable in the way that older women have become aware of their prevalence toward heart disease, and that the steps that can be taken to recognize symptoms, to get to medical care. It actually helps to educate some of the providers that have not become aware, too, of the information that's available recently. It does some data collection. We just want to expand it to all states if they choose to incorporate it. It's already been approved. It's a part of CDC.
Will the gentlelady yield? Will the gentleman yield?
I'll yield to whom I
I'll be glad to yield. I did have one question I wanted to ask the gentlelady.
The minority wants to stipulate that all women are wise. Let's just get that on the record. We don't want to debate about whether women are wise. All women are wise.
Reclaiming my time, if I have the time, that means not just the Supreme Court nominee, I'm sure, and I'm glad that you made that comment, Mr. Barton. I wanted to ask one simple question from the gentlewoman from California, from Ms. Capps. Is part of this program paying for cooking classes as well?
No, it's screening, actually. It provides screening for older women who aren't necessarily covered in any other way so that they can become aware of symptoms that they might have. It's a way to get women into treatment more quickly than to wait till some costly treatment is perhaps needed later.
Well, reclaiming, I mean...
Although nutrition education might be part of some of the outreach programs.
Further asking for yield of time.
Of course.
As you described the program, of course, it sounds good. I just think we could be spending a whole lot of money teaching cooking classes, and that was why I wanted to make sure.
Thank you. This has been verified to be effective in the pilot states in which it was initiated, and it's only based on the positive outcomes in those states that it is now being recommended by the CDC to be applicable to other states as well.
And I thank the gentlelady for yield.
We have before us a point of order.
Mr. Chairman.
And I'd like to deal with the point of order before we get into further discussion on the amendment itself. Anybody wish to be recognized on the point of order itself? The chair is ready to rule. The point of order has been asserted that this amendment is not germane for two reasons. Primarily that it passes a provision that would be in the jurisdiction of the Ways and Means Committee. On page 4, the effective date says that the Public Health Service Act provision, which is in our jurisdiction, shall take effect on the effective date of a statute establishing a voluntary payroll deduction under the Internal Revenue Code of 1986 to support the program authorized by such title. That had we legislated an effective statute of a payroll deduction, that would be outside the jurisdiction of our committee. What we do in this particular provision is establish the program, but the program, which is under the Public Health Service Act, would not take effect until the Ways and Means Committee establishes the tax. The second assertion of non-germaneness is that the community health centers provision giving liability protection would not be in our jurisdiction. This amendment to allow volunteers at the community health centers to be covered under the liability protections under this act is under the act in the public health programs. The community health centers are under the Public Health Act, and the parliamentarian in the past has always referred such bills dealing with anything pertaining to the health centers to us, including liability protection. So the chair would rule that the point of order is not sustained. I want to call for further discussion of the amendment before we proceed to a vote on the pending amendment.
Mr. Chairman.
Who seeks recognition?
Mr. Chairman. I won't take all my 5 minutes or whatever minutes we have, because I know most of the speakers on the other side are concerned about laying out a manager's amendment. And if the staff could explain to us, because it seems like being on this committee for a number of years, I remember this same thing happening, having a bill and then coming to the committee markup on a regular occasion, even when the majority was the Republicans, to have a huge manager's amendment laid out for our consideration. Is that not correct?
Would the gentleman yield on that point?
Be glad to yield, but I'd like the staff to remind me of previous times where we'd see a manager's amendment of X number of pages.
It is not unusual in this committee for there to be a manager's amendment of substantial size.
Thank you. And be glad to yield to my friend Joe.
I agree with it. I agree with what the council said. The difference is, at least when I was chairman, when we did manager's amendment, the manager's amendment was published, and both sides had a chance to look at it before we went to markup for a number of days. We never sprung, so to speak, a manager's amendment, and I don't remember ever having a manager's amendment in the nature of the substitute and then having the first majority amendment be, in essence, an addendum to the manager's amendment. I don't recall that ever.
Well, it seems like I remember 2003. Now, Joe, you weren't chair, but I also know this amendment was laid out last night at 10 o'clock, and my staff was able to look at it. And so, you know, let's argue about not the process, because I get calls all the time about you didn't read the bill, and I said that's our problem. But for 233 years, I haven't been able to get Congress to read bills. And but if you want to complain about the process, that's one thing. But if you want to complain about the issues that are in the manager's amendment, that's separately. And we might move along quicker and at least be able to deal with it. And with that, Mr. Chairman, I'll yield, return my time to you if you'd like.
Just yield back your time.
Mr. Chairman. Thank you, Mr. Chairman. I have a question of Mr. Pallone. I don't see Mr. Rush here. But on page 57, subtitle O, Postpartum Depression, we have dealt with this issue in the two previous Congresses and adopted compromise language bipartisanly, sense of Congress language regarding a longitudinal study of relative mental health consequences for women of resolving a pregnancy, and in various ways that they may have resolved a pregnancy, including carrying the pregnancy to term, parenting the child, carrying the pregnancy to term, placing the child up for adoption, for miscarriage, for having abortion. So we had compromise legislation that included postpartum depression on the issue of abortion. I was just wondering why the compromise language that we passed in the two previous Congresses wasn't included in this language. Could you? I think this is very important, because increased research on post-abortion depression would lead to greater awareness of the issue and the development of compassionate outreach and counseling programs to help post-abortive women. So I think it's important. I was just wondering if you could explain why that's not included.
Mr. Pitts, would you yield?
Yes, I'll yield.
We've actually brought up the same concerns, and you're right, we did have compromise language. It was Section 102 of the Sense of Congress regarding the longitudinal study of relative mental health consequences for women of resolving a pregnancy. With your acceptance, we're willing to put that language in to make sure that's clear. That was raised earlier, and we have it here, and we're willing to do it. Just didn't get it in time. So with your acceptance, so I need unanimous consent.
Section 102 language, yes.
Yes.
Yes, I would accept that.
Well, if it's appropriate, Mr. Chairman, I'd ask unanimous consent to.
Gentleman from Michigan seeks recognition for unanimous consent request. Would you state your unanimous consent request?
Mr. Chairman, I'd ask unanimous consent that Section 102, the sense of the Congress regarding longitudinal study of the relative mental health consequences for women of resolving a pregnancy, would be included in this manager's amendment in the appropriate section.
Is there any objection?
I'd like to reserve the right.
I recognize the woman from Colorado.
Mr. Chairman, I'm not going to object. I just would like to say that I think this compromise language is good, and I think we should look at the results. In the past, Mr. Stupak, Mr. Pitts, and I have all had disagreements on how we characterize some of these issues, but I think there can be mental health issues resulting from pregnancies, and I think this is good compromise language, and with that, I'll withdraw my reservation.
Mr. Chairman.
Yes.
One more time, and I'll shut up. Okay? We have operated on both sides in reasonably good faith on the health care issue. And you have been more than accommodating this week in requests I've made as to schedule. This particular amendment, in my opinion, is in very bad faith. It was posted on the G drive at 10:28 last night. Now, I don't know about other members. Apparently, Mr. Green's staff sits by the G drive all night long, and I want to commend him for that.
We want to make sure we read it all, Joe.
Well, I commend you, but I would suggest that you withdraw this amendment. There's some good things in it. There's obviously some good things in it, but it is a little unusual for the majority for their first amendment to be an omnibus amendment that was not readily accessible under normal conditions before the markup began.
Gentlemen, yield to me.
I'd be happy to yield.
If you feel so strongly about it, I think you make a case that you ought to have more time to look at it. So I'll join you in asking the gentleman from New Jersey to withdraw his amendment without prejudice, and that he be permitted to offer it again. Yes, we're withdrawing the whole omnibus amendment.
I would withdraw it at this time without reservation to bring it up.
And I would like to request that...
Parliamentary inquiry?
No, just a minute. I'd like to request that we be able to deal with this amendment before we leave today, if that is acceptable.
Well, that's better than... Sure. But
okay.
Well, parliamentary inquiry?
We've got a vote on. We've got a series of 13 votes at about 12:30. So we basically got 50 minutes before we end for the day, because we're going to, these next series of votes are the last votes of the day, and they're going to take till 2 or 2:30. And by previous agreement, we'd agreed to end the markup today about 2 o'clock. So we're actually saying you've got about 45 minutes most. It'd be better to just pull this one off, bring it up first thing next week if you want to do that. But if you're bound and determined to have it voted on today, I can't stop you.
Parliamentary inquiry?
Who's seeking? Mr. Shadegg.
Thank you, Mr. Chairman.
State your parliamentary inquiry.
I'd just like to get a clarification of terms because I am trying to follow the ball game here. This, I understood, was the bill. This, I understood, was the manager's amendment. But we've been talking about, and Mr. Green referred to this as the manager's amendment. Is this the manager's amendment to the manager's amendment?
That is an amendment to the manager's amendment.
Amendment to the manager's amendment. So it's the amendment. It's the amendment by the chairman of the subcommittee to the manager's amendment.
That's correct.
I thought counsel was asked whether manager's amendments are common. I did not hear counsel asked if managers' amendments to managers' amendments are common. Maybe I should ask counsel that question.
The chair will announce on your parliamentary inquiry, if you find any rule that says this can't be done, please raise it. Otherwise, we have a request from Mr. Barton to withdraw the amendment. The gentleman from New Jersey has withdrawn it. I would take the recommendation of the gentleman from Texas that this be put over till next Monday, and we'll do that.
I was just trying to clarify things, Mr. Chairman. I was not objecting. I was simply trying to find out what we were talking about.
Okay. I hope the gentleman knows.
Mr. Chairman?
Who is seeking recognition?
Over here, Mr. Chairman, on our side.
Yes.
A parliamentary inquiry. What happened to the UC request regarding the Section 1 whatever language? Did that get adopted?
No.
Because it was pending, right?
It was pending.
So don't we have to take...
We put the whole thing aside. And I understand somebody wanted to look at that language as well to be sure it met the requirements. So the whole matter is put aside, including the separate issue in the Pallone Amendment dealing with restaurant labeling.
Thank you,
Mr. Chairman.
Now, gentlemen.
Parliamentary amendment, question. When Mr. Pallone reintroduces or brings the amendment back, is it my understanding, based on our colloquy, that it will include the Section 102 language that we have passed in the previous two Congresses?
Well, I would hope that could be worked out, but he'll be recognized to offer an amendment. He may offer a different amendment. He may offer it in a different way, but it seemed to me that we were pretty clear that there was going to be unanimous consent for that language that you had suggested.
Thank you, Mr. Chairman.
Would you want to complete the unanimous consent now? Well, let's hold it for Monday. Let's don't get tied down. The Pallone amendment has been withdrawn.